You may have come into Medicare last year, the year before, and you recall having to make a lot of choices and a lot of decisions that you weren't really expecting to have to make when you start Medicare. Do you want to go Medicare Advantage? Do you want to stay original Medicare? Do you need a drug plan, a Medicare supplement, all that stuff that just can drive a lot of people crazy and they really don't understand it. So now you're in Medicare and you may realize that you're not in the type of plan that you want to be in. And that can certainly be a problem going forward. So the question now is, can I switch my Medicare plans? How do I switch my Medicare plans? I'm going to go through that right now. There are different options for different plans. So they make this complicated as well. So we want to make sure we understand it, because pretty rarely will somebody come into Medicare, especially right at age 65, and then stay on the exact same plan for the rest of their lives. At some point, you're going to need to change, and you may need to change quickly, and you may need to change before you want to change due to other factors that may come along. So this goes back into the differences between Medicare Advantage and original Medicare. If you recall, when you start Medicare, your first big choice is, which road do you want to go down? Do you want to be on a Medicare Advantage plan? All the stuff that you see on TV, Medicare Advantage is outside of Medicare, even though it's called Medicare. They are private insurance carrier plans. So in other words, they're run by a private insurance company. Medicare actually pays that private insurance company to take over the responsibility for your medical claims. So it gets you off the books of Medicare. So it's somewhat favorable to Medicare, even though right now they're paying more to a Medicare Advantage plan to take you away from Medicare than they would pay for your claims if you stayed with Medicare. So I have no idea who's in charge of how that works or why they would do it that way. It sounds kind of fishy in a lot of cases, but that is the reality right now. But regardless of that, when people start Medicare, right now, it's about 50-50. 50% of the people are in Medicare Advantage plans, and the rest are still with original Medicare. So if you've seen any of my other videos, I 100% recommend staying with original Medicare. It's fantastic. It's likely the best run government program there is. Why you would choose to leave that is beyond me, because it gives you all the freedom and the flexibility to do what you want. Medicare actually pretty much stays out of the way. It's between you and your doctor when you're with original Medicare. If he says you need something and you agree and it's medically necessary, it's covered. You don't have to ask for permission. You don't have to jump through hoops. You don't have to go through crazy paperwork to get things done. And it's completely the polar opposite that with most Medicare Advantage plans, where they do get in the way and their profits depend on how much they spend on your health care. And that is not where I would want to be with my health care, especially as I'm getting older and things are coming along, and they're coming along fast. So just that's the first issue that you face when you come in to Medicare. Now, let's assume that we are already in Medicare and we have chosen the wrong plan and we need to change. So what we need to understand first, it is different from a Medicare Advantage plan versus a Medicare Supplement plan. So Medicare Supplement is what you have when you stay on original Medicare. Medicare Advantage plan locks you into a Medicare Advantage plan. Once you make that choice, you are locked in for typically a year. So Medicare Advantage has what is called Medicare Annual Election Period, the Medicare Open Enrollment Period. They call it different names to confuse us as well, but that's exactly what it is. And how it works is you start a Medicare Advantage plan when you come in, and then at the end of every year, you have the ability to change, because the plans can change. And they have to give a window for you to be able to change, because your doctor may have been in that Advantage plan and is no longer in that Advantage plan. Or your hospital, your main hospital where you would seek your health care, could have been in the Advantage plan, and then they have a contract dispute and they're no longer in the Advantage plan. So you need to find different coverage. And that, again, is one of the problematic parts to me on Medicare Advantage. So when we look at that scenario with Medicare Advantage, how to change, the annual enrollment period, the Medicare Open Enrollment Period, runs from October 15th to December 7th every year. So you have to make a change within that window. and then it becomes effective on January 1st. Also, the same for a Medicare drug plan, because Medicare drug plans can change quite drastically. They can have drugs that are in a certain tier, and then they go into a different tier, and expenses mount up, and they change. So you have the same ability to make that change once a year. So Medicare Advantage, Medicare drug plan, you have that open enrollment period at the end of the year from October 15th to December 7th, takes effect on January 1st. Now, outside of that, they have another period for the same scenario, and it runs from January to the end of March, so up until April 1st. So I don't know why they separate these two windows, because they're pretty similar, and this period is what I would call a Medicare Advantage disenrollment period, and this, to me, is there for people that get pushed into a Medicare Advantage plan and then find out it's not what they thought it was. So they need to be able to get out. So they created this window that runs up until April 1st at the beginning of the year, and you make your selection or your change at any time in that period, and it becomes effective the first of the following month. So in reality, we have this open enrollment period that runs from October 15th to December 7th. Make a choice, becomes effective on January 1st, or if you messed it up, you figure out on December 10th that you need to make a change and you miss that window, you now can wait until after January 1st, make the selection, and it would become effective on February 1st. So if you miss that window after April 1st, at the end of March, you would have to initiate all this and cancel whatever you currently have, then you're stuck for the year until January 1 of next year, which, again, is crazy why they force you to stay within a plan, especially because things can still change in June or July, and you have no recourse. So again, another reason, personally, I am never taking a Medicare Advantage plan. There's just too many things that can adversely affect us as we're aging through this. So when we talk about original Medicare, the other side of the coin with the Medicare Supplement, which again, that's what we do. We help people find the right Medicare Supplement plan. That's how I make my living. Full disclosure, no secret. And I could sell Medicare Advantage plans if I wanted to. It's not hard to do, but I would absolutely not be comfortable selling something that I would not choose for myself. So I do not offer Medicare Advantage plans. I only help people with original Medicare, with their Medicare Supplement plans. And guess what? I get no customer service phone calls. Nobody yells at me. Nobody calls up screaming because things have gone wrong. Everything really goes exactly the way you would want it to with your health care. And just that's the way I would want it going forward. So with a Medicare Supplement plan, you can change any time. You don't have any lock-in window periods and have to figure out exactly when you have to make a decision. You can change any time for the beginning of the next month. The caveat to that with a Medicare Supplement plan, and a Medicare Supplement plan is run by pretty much those same private insurance companies, but it's a completely different insurance product, and they don't play any part in the decision-making of your health care. Everything is run through Medicare. If Medicare covers it, the supplement plan has to cover it. They can't say yes or no or require you to get pre-authorization or try step therapy or do other things before you do what's really going to help you. They play no role. So therefore, I get no complaints, and you'll never really interact with the insurance company because there's not a decision there to make. If it's medically necessary, your doctor says you need it, Medicare covers it, they have to cover it, period. No decision whatsoever. The doctor doesn't even interact with it. The doctor only interacts with Medicare, and Medicare collects from the supplement company. So terrific. So back to the caveat, if you're going to change a Medicare supplement plan, and yes, premiums can go up on Medicare supplements. They can have rate increases year after year after year, sometimes small, sometimes bigger, but we want to make sure we get the best value. So once you're in a Medicare supplement plan in Medicare, in order to change in most states, you have to go through medical underwriting. In other words, you have to be approved. You have to be in pretty good health. It's not complicated. It's basically a list of questions, and if you answer no to all the questions, then you can pretty much change. It's not a complicated scenario, but it can be problematic if you have health issues. So we want to make sure we get the right plan to start with. So if we do have to stay with it due to medical issues, then it's going to work for us no matter what. But it's really not complicated. But that's kind of the scenarios on changing Medicare plans. If you're going to change your Medicare Advantage plan, you got to make sure you know your timelines, know your windows, know your selections, know your plan, and know that it can change really at any time. With a Medicare Supplement plan, much less to know, and it's not going to change. It is what it is throughout the year. There's no change to it whatsoever, and it just makes life that much easier. So I hope you found this helpful. We're here to help. Make sure you join my Facebook group called Talking Medicare. It's talkingmedicaregroup.com. Will take you right there. It's free. Great place to learn and interact with others and see questions from others, and it's just very helpful. I hope you found all this helpful. Have a fantastic day. Thank you for taking the time to watch my video. I hope it'll make things a little bit easier as you're trying to figure out all your Medicare pieces. Now, if you're going to stay with original Medicare Part A and Part B and a Medicare Supplement plan, G or N or GHD, whatever it may be, we can help with that. So that's exactly what we do, is we find the best Medicare Supplement plan in your zip code. So if you go onto my website, MedicareOnVideo.com, put in your basic information, we will email you a quote with the best value in your zip code. Makes it very easy to do. You'll see right on my site below the box, we do not share or sell your information with anyone. But do be careful if you're filling out other websites. That's exactly what most of them do, is they take your information and they sell it to multiple agents, and you're bombarded with phone calls. So we don't want any of that. We want to make it as simple and easy as possible. We have access pretty much to any carrier in all 50 states. So we can make it as easy as possible. If you want to get a little more comfortable, just Google Medicare on Video and look through my Google reviews. We just have a tremendous amount of very happy people that found it simple and easy to do and get the right plan that they're looking for. So it's in your best interest, and I get no customer service phone calls. So people are happy. I'm happy. It's a terrific way to do business. I certainly hope you'll allow us to help you. If you need anything at all, feel free to utilize my information on my website, my book you can download, and we'll do everything we can to make sure we get all your pieces in the right places. Have a fantastic day.